Good morning, my name is Ella. I'll be the student nurse taking care of you today. Let's go ahead and close these curtains here to ensure privacy in the room for us. And I'll wash my hands here for 20 seconds. Can you kindly state your full name and date of birth for me, please? Checking your wristband here. Mrs. Pizza Planet, January 12, 1980. Perfect, that matches. How are you doing today? Good, good. I'm glad you're doing well. Do you have any pain right now? No pain, but some discomfort. I see. Now, where do you feel that? Located in your lower abdomen area? All right, well, that does make sense because it seems that we do have a case of urinary retention, hence why you may be feeling those symptoms, and that's why I wanted to check up on you today. So that's a scenario where our bladder keeps filling up with urine and it overfills because we're unable to excrete that urine out properly as it should. Now, this could lead to a possible infection, so that's something we'd like to prevent. Now, our doctor has ordered a procedure to get done today, which is me helping you out with inserting a Foley catheter. Have you had this done before? No, you haven't? Okay, that's no worries. So I'll guide you through the steps. Initially, we'll cleanse our perineal area with some cleansing wipes and antiseptic solution swabs. We'll then take that catheter, which is a soft plastic-like tube that will go through your urethra all the way up, insert into your bladder. That will then serve as a drainage tube to allow the urine, the trapped urine, to flow on out into a drainage bag. You'd be able to move around and even walk around with this device so long that I stabilize it with a water balloon that will stay in place in the bladder, and that will prevent the catheter from coming on out. Now, do you have any questions or concerns for me? All right, it wouldn't be painful, maybe just a little awkward feeling as I insert, but I'll make sure you're extra comfortable during this, okay? And any allergies that I should be aware of, specifically to chlorhexidine or adhesive? No as well? That's great. Okay, I'll take some moments to get started and we'll get going, okay? Thanks, Mrs. Pizza. Wash my hands. And I just want to grab the sandy wipe here and wipe down our workspace. And did you order breakfast already, Mrs. Pizza? No, you haven't yet? Oh, okay. I'll make sure to order a tray for you as soon as we're done here. And then I'll let you enjoy breakfast, okay? Okay, while we let our table dry for the 2 minutes, I'm gonna wash my hands again and prep you in the proper position so we're extra comfortable. If I could start off by laying you flat, great, thank you so much. And I'll just roll down your blanket here if you don't mind, and I'll just unveil the area that we'll be working with. And we'll leave this site exposed for now just so we could get started. And if I could just rotate your legs here in a frog-like manner, that will allow easier access for me to go ahead and work and make you extra comfortable. And I notice here we also have a chucks in place that'll keep our things nice and dry, and if it happens to get wet, I'll exchange that out for a fresh new one afterwards, okay? I just have these cleansing wipes that I mentioned. How are you doing? Good, good, good. Okay, last wipe here. Let's just cover you back up to not expose you, and if you keep in that manner, that would be great. That will just have us ready to go. Washed my hands. Table has dried for the 2 minutes. What I have here are the supplies, and this is a Foley cap kit. I have a stabilization device for the catheter later on. This 10 ml syringe that's sterile, and a CHG wipe. Just a few moments here, okay, Mrs. Pizza? And if I could just expose your area here since we're going to get started now. Thank you very much, Mrs. Pizza. I just want to go ahead, wash my hands again, and take this sterile drape out as a way to have a sterile workspace in between our legs. Great. Washed my hands again. And since I have minimal space here to apply my sterile gloves, I just want to be extra safe and clean out another workspace here. 30 seconds with the Sammy wipe. 30 seconds done. We'll let that dry for 2 minutes. How are you doing, Mrs. Pizza? Good? Okay. We're about to get started. I washed my hands again. Area has dried. Just fixing the fingers here. All right, just a few more moments, Mrs. Pizza. I'll take this sterile specimen cup off to the side. We'll use for later. We'll tear open these swab sticks and let that be stand on the side here. Okay, our box is ready. Now let's go ahead and move on over here. So we have another cleaning session, Mrs. Pizza. We have these 3 swab sticks. So what I'm going to do is retract your labia here. And it might be a little cold, but we'll go ahead and clean, okay? How are you doing? Good, you're doing an amazing job. Beautiful, thank you so much. We'll get rid of this. And now it's time for the insertion of the catheter. I want you to take a deep breath in. And as I do so, on the count of 3, I want you to blow out, and that's when I'll insert, okay? Okay, breathe in for me. 1, 2, 3, blow out. Perfect, it's in. Let's go until I see urine flow, which I do now. Great, so I'm going to advance 1 to 2 more inches to make sure we're really in the bladder. Perfect. And now I'll just take time to inflate the balloon. You feel any pain right now? No pain? Good. That means we're in the bladder. Okay. And I'll make sure there's resistance. That means we are in. Cover your back up. How did that feel? Good, good. I'm glad. Well, since we're here, we also like to take a specimen sample. So what I'm going to do is take my sterile hand and grab that CHG wipe we had from earlier. And I'll wipe the port here for 5 seconds. Okay, and we'll also let that dry for the 5 seconds while we grab our syringe here to extract 6 ml. Great, how do you think that went? I think you did an amazing job. I'll wash my hands again. So let's get cleaned up for you and get out the way now. It's a warm day today. It seems that my gloves aren't going on. I have sweaty hands, but that's no worries. So thanks for being patient with me. Okay, let me get this out of your way now. Okay, let's discard of this. And if I could sit you back up, great, and get you comfortable again, straighten out your legs and whatnot. So let's go ahead and grab that skin protectant that goes along with the stat lock. This will go against your thigh just so the adhesive that is on the stat lock wouldn't be too harsh when we remove it, okay? Just to protect your skin. Perfect. We'll grab that stat lock. This is the other stabilizer I mentioned so that we could adhere this to your thigh. And we'll take the backing off here. Perfect. And we'll this drainage bag go on to the side of the bed frame here and secure the tubing as well, and make sure it's below the bladder as a way to ensure the drainage of urine continues to flow on out properly. So that's adhered on, and let's just cover you back up so you're more comfortable. Get this warm blanket back on you. And last step before I get on out of here, I'll wash my hands again, and we got that sterile specimen cup, so I want to get that urine extracted and get that filled in and be sent to the lab. So we could check out and if everything's going all right. All 6 ml in. Closed. I'll write your name and the date and time I collected the specimen and as well as the MRN. All right, let me wash my hands. How do you think that went, Mrs. Pizza? I think you did an amazing job. I'm very proud of you. Thanks for letting me take care of you for that. So before I leave, do you need anything else from me? No? Any questions? Any pain or discomfort right now? Okay, good. Hopefully that's granting you relief. And I see that your urine is now flowing out, so it seems like we did a good job. So before I head on out, let's put you in the lowest bed position. Here's your call it. I want you to call me if you want to get up. That way I can show you how to manage your bag and your catheter so we could prevent that possible scenario where it comes out. And just be mindful if you move around in bed, if you happen to roll around, so as to not kink or block the tubing so we don't have a backflow of urine, okay? Okay, I'll get on out of here and I'll order that breakfast I mentioned for you. I'll see you later. Thank you. Okay, wash my hands. I will now document the date and time I did this procedure. I will note that Mrs. Pizza tolerated the procedure well with no pain. I will note that I used a 16 French catheter size, and then I will say the urine collected in the bag and seen in the specimen container has a light yellow color with no foul odor, no sediments, and no cloudiness noted. Hello, my name is Ella. I'll be the student nurse helping you today. Let's go ahead and close our curtain here to ensure privacy in the room and wash my hands here for 20 seconds. Mrs. Pizza, do you remember me? I'm the student nurse who helped you the other day. My name is Ella. I inserted that Foley catheter for you. Yeah, you do? Well, I am glad to be back because it seems that we have good news. It seems that your retention has cleared out and all that urine has come on out and you'd be able to get that removed per what the doctor said. So yeah, it's very good news. Before we move on, can you just verify your full name, date of birth for me, please? Checking ID band, Mrs. Pizza Planet 1980, January 12th. That's great. So how are you doing? You're doing much better. I bet you feel relief from those symptoms we had a few days ago, huh? Yeah, I'm glad. But any pain or discomfort right now? No? Okay. Any allergies that I should be aware of again? No? Okay, yeah, great. So the procedure we'll get done today is essentially the removal part, which is a very quick and easy task for us to do. I want you to be as comfortable, so we'll place you in the position we were in when we inserted, like similar to that, and then I will deflate the balloon, which is holding it in place right now, and then it'll be a quick removal. When you inhale and exhale, that's when I'll take it out, and we'll go from there. Okay, how does that sound? Good. Okay, I'm ready for you. Let's wash my hands again, and if we could lay you flat, that would be amazing. Thank you, Mrs. Pizza. Let's roll down your blanket here. And then if I could unveil your gown just a little bit. Perfect. Do you remember that frog-like legs that we do? Yeah, we'll do that again, and that will allow easier, make it easier for us and make you more comfortable. So I place this chucks here, and that will kind of catch that catheter as it comes out. So I'll just replace my gloves. Wash my hands again, and I have my supplies ready for us. So what I have is that 10 ml syringe that I'll use to extract the water out and get this removal going. Okay, as I extract, I just want to hold it just in case it might fall out. But what I want to do is extract all 10 because it might be painful if there's any urine, or not urine, but water left in the balloon, and we want it completely deflated so we'd have an easier removal, okay? And it seems like that we did. So now it's time for the removal. I want you to take a deep breath in for me, and when I say 3, you're gonna blow out, and that's when I'll take it out, okay? Breathe in, blow, and 1, 2, 3, blow out, blow out, blow out for me. Good job. You did amazing. Let's remove the stat lock adhesive here. Good, it was able to come off easily. We'll grab our tubing here from the Foley catheter. Great, how do you think that went? Okay, let's just place this here for now. Let's roll you, put you back in the proper position, have your legs straightened now. Get this blanket nice and covered for you. How do you think that went? I think that went great. So if there were any resistance, I take a moment and say, hey, maybe there's still some water in there. So I would have taken a moment to extract some more. And if that wasn't the case and there was still resistance, I would have stopped and let the provider know, because I do not want to take that catheter forcefully out. But luckily for us today, it was easily coming out for us. So good job. Now, I'm going to go take care of this, if you excuse me, and I want to dispose of the urine by collecting it in a cylinder in the bathroom really quick, okay? Okay, I'm in the bathroom now, pouring the urine into the graduated cylinder, and I see a measurement of around 400 cc's of urine collected. I will now discard and dispose of this catheter and the Foley bag in its proper place. I'm back. Hi, Mrs. Pizza. So I took care of the urine, and I'm gonna wash my hands here. So before I head on out, I just want to give a few educational tips, since it might be a minute since we were able to urinate on our own. So what I'd like to share is that for the next 1 to 2 voids, so that's when you need to go to the restroom, for the two next times, I want you to let me know, because I want to make sure that we're emptying our bladder adequately, and that's me measuring the urine output that we are getting from you, okay? I also want to warn that it might feel a little burn or stinging sensation the first time you do void, since you know, we haven't been able to do that naturally, but it will decrease with less pain and discomfort over time, okay? So don't worry about that. And I want you to let me know by any chance that when you do urinate that it is extremely painful, or if there's any bleeding that you see, let me know, and we'll get that checked out and talk to the doctor about that, okay? So let's leave you in the lowest bed position. If I haven't washed my hands already, I want to give you a call right here, and the instructions I said, try to follow it as best as you can so I could keep updated with you, okay? Thanks, Mrs. Pizza. It was nice seeing you again. I'll leave you to it, okay? Bye-bye. Left the room. Wash my hands. I will now document the date and time of the procedure, and I will note that Mrs. Pizza tolerated the procedure well. As I remove the catheter, I will describe the urine collected, which was a light yellow clear color, around 400 cc's measured collected, and I will make sure to document the next 1 to 2 voidings of this patient.